Tara.
You all right?
Yes, thank you, Tara.
How's Paul?
He's okay. He's getting along all right.
Oh, good. I missed him. Is Paul able to get on Zoom, David?
Is he what?
Is Paul able to get on Zoom?
He is when I'm with him, yes.
Right. I'm going to give you a ring about that then.
All right.
Hi, Damien. You know, if people have are able to share, or do you need me to look into that?
Could you look into it, please, and make sure everyone can share? That'd be great.
Yeah, I'll have a look. Sorry, I was a bit late. I had some important interview stuff to send out.
Don't worry, Kelly. It's fine. Thanks for coming along.
Hi, Emma.
Hi, Tara. Sorry I'm late. I just had a delivery from my best friend who lives in Australia of a load of buns and cakes and things.
Oh.
Just feeling a bit of mush.
Makes up for your International Women's Day. Afternoon tea not arriving.
Yeah, exactly. So I've got a salted caramel brownie.
Ooh. We did an International Women's Day, Damien, on Monday.
Oh, yeah.
You know, usually we do big events. We did it on Zoom. So because we were saving money on food and venue hire, we sent everybody out who were coming an afternoon tea.
Mm-hmm.
They were $9.99. And then on Saturday, I went to order another one because I'd forgot one. They'd gone up to £23. Because I'd ordered 20, somebody thought, ka-ching.
That's why I didn't get one.
That's why Emma didn't get one. You all right, Gabe?
I do.
Long time no see.
Aye.
Right. Well, thanks for coming along, Yvonne. I'm actually going to make a start. As there's a few of us here already, and there's a bit to get through. So, okay, well, my name's Damien Daughtry. I'm coordinator of Men's Health Unlocked, and it's lovely to see you all. Thanks very much for coming along. Kelly, would you mind posting the agenda into the chat box, please, for us, if you get when you get a chance, please? That'd be
Yeah,
great.
I'll just grab that now.
Thank you very much. Just a bit of housekeeping to start off with. Just to let you know that we are recording this meeting. So if you would not like to be recorded, please could you could you let us know, please? Let Kelly know, who's helping out here. Well, I've lost her on the screen. I've lost somebody on the screen already. There must be a few here, but she's down as online meetings actually today, but her name is Kelly. Or let myself know if that is an issue for you. No problem. Also, could we say, if you're not talking like I am now, could you put your mics on mute, please, just to keep the background noise down. So if you can all put your mics on mute, that'd be brilliant. Thank you very much. That's lovely. So today what we're going to do is I'm going to give you, for those who don't know, I'm going to give you a little intro about Men's Health Unlocked Network and what it is. Going to give you a bit of an update on some stuff going on in the field of men's health and well-being in and around the city that you might be interested in. We are also a highlight for me, really, I suppose, in many ways, are the workshops that 4 people working in men's health and well-being in Leeds have very kindly offered to come and do this afternoon. And so those workshops will be taking place at 1:30. I'll go a little bit more into that in a bit. Then we'll have a break, and then we'll have a bit of sort of feedback and discussion about the workshops and what we've learned there, what we've heard. Now I'm also very craftily, I'm actually going to be sneaking in a little survey of you guys as well. I hope you don't mind me doing that. I'm going to give you a very quick survey on the workshops, and the workshops are finished, just to see what you thought of it. It's like 2 questions. And then before the workshops, I've just put aside 5 minutes, I hope you don't mind, to lead you through some questions about the network. That'd be really useful for me and my colleagues at Forum Central and the wider network to see how we can develop it and just to help us doing our plans going forward, writing funding bids and things like that. So I hope you don't mind. I hope you see it as a worthy payoff in return for workshops and the chance to meet everyone. So I hope you don't mind us stealing a little bit of your time for that, please. And thank you in advance for that. Okay. So before I give a little Men's Health Unlocked update, is Lawrence here? Are you here, Lawrence? I can't see you. Is he here? Oh, he's not here. Oh, okay, never mind. All right then. Well, maybe you can do it later. I don't know, sort of diversion for us. So one of the projects has been creating artwork for men, and he had a little poem he's going to share with us. So that might have to come later. Not to worry. We shall crack on. I'll give you a little introduction then to the Men's Health Unlocked Network. Before I go on, are there any questions at all about the format of the session or anything that anyone would like to run past me? No. Brilliant. Okie dokie. Right. So let's have a look then. I'm just going to share my screen. Just bear with me. Can you all see your faces on there? Can you? Yeah. Yeah, that's better, isn't it? Right. So Men's Health Unlocked then. For those of you who don't know, it's a network. It's coordinated by Forum Central. Me and my colleague Zoe Ricketts helped coordinate the project, and it's about linking up all the different work that's been going on in Leeds, supporting men's health and well-being, in the community sector, in the statutory sector, in academia. And the idea of it is just to try and link everyone in and link the men in themselves. That's those two guys at the bottom of the picture there, for example. Link those guys in with the stuff that's going on around the city. And you see those three sentences at the top: connect and liaise, involve and develop, and promote and celebrate. Yes, that means the men. We want to connect the men with services, with healthcare, with men's organisations. We want to involve them, we want to help them develop themselves. We want to promote them and celebrate them, but also we want to connect and liaise with all those other people in there and help them bring their services and what they do more in line with what men need and say that they want. And it's all about taking a gendered response to health inequalities regarding men, which is like a posh way of saying finding out what things are particular to men's health and well-being needs and what we can do to help. For example, an obvious example would be the high suicide rate or the lower life expectancy for men. So what is it about men that we can do to stop that happening as much and trying to support men there? Okay. So that's what we're about. What do we actually do? Well, this networking meeting for a start, we've set up a directory of activities, a what's on called Let's Unlock. So far, I've got 17 different activities on there. Can I just, if you don't mind, if you can put your mics on mute, please, that would be brilliant, if you don't mind. Thank you. So we've got 17 different activities on there. We'd love to have some more. It's already been of use to some people, this finding out groups and activities for men. So please, this network is as good as we make it. It's not Forum Central's network, it's our network. And things like that database, that directory, are as good as you guys make it. So we need you to put into that, and people will use it. You'll notice if I was to click on it now, can you see that? Sorry, I can't see your faces now. I've asked you all to mute.
Yes, I can see that. Yeah.
Lovely. Thank you, Kelly. Perfect timing. Thank you. So here we are. This is the what's on of activities. Okay. I'm sure you can look at it for yourself, but as you can see, it's a little bit, it's quite texty. So if you do put stuff in, don't make it too texty. You won't look very good. Okay. So we've got the networking meeting. We had our launch event. If you go to our YouTube channel for Men's Health Unlocked, You'll catch some interviews with Alan White there that he did for it. We had 70 different organisations link up with us in one day there, with videos from some of you present here for that. We've got a web page. We've helped with some funding. Yeah, and for our first networking meeting, we had over 50 different people, which was great. And we've got a really great attendance here today as well, so thank you for that. Another aspect of the project is that we've partnered up with Barker, with Orion, and with Touchstone, and they have been delivering projects for us too. So Barker have been giving out tablets for digitally excluded men. Orion have continued their Manbassador project and produced magazines because of lockdown. That's adapted and produced magazines for that. And then Touchstone have been doing sort of text-based social support groups as well. Okay. At the moment, we're funded by the lottery for 6 months. We started in, I say 6 months, we started in sort of mid to late November, and unfortunately we had to start late. The funding for that runs out at the end of this month, but I'm pleased to say we have secured continuation funding, and we're looking for some longer term funding too. And that's because of your guys. A lot of it is to do with the great work of our partners here you see on the screen, but also because you guys have really got into it and have contributed, and you've been coming to these meetings and you know, you've been wanting to reach out and link out with other people, and we've been able to help you with that, and we feel like we've just been an important part of the jigsaw, but we all are part of that jigsaw, aren't we? Okay, so looking ahead, we're applying for money for more funding. We are looking to make sure that we have a steering group made up of men and other people, other stakeholders from around the city, to help us steer the network in the direction we want it to go. And I'm also looking at trying to create some support for men facing redundancy as well, because there is a link between redundancy and suicide, and we all know about the threat of redundancies coming up. Okay. Oops. So okay, so just an update on current and emerging issues. So that's Men's Health Unlocked. Now just quickly update on the emerging issues and trends in men's health and wellbeing at the moment. Of course, you've got the ongoing ones, which I've touched on already. And you've got the COVID death rate being, you know, twice as many men dying from COVID-19 as women. And it's particularly worse for men from ethnic minorities. I should add, actually, sorry, do you know what I'm going to do now? I'm just going to pause there, because what I haven't done, which I promised myself I would do, is to put in the text box, if I can get my screen to go big again. Oops. Oh. I can't get my screen to go big, the Zoom screen. Help. Oh, there we are. Oh, it's because I'm screen sharing, isn't it? That's why. Right, okay. Okay. I beg your pardon. I'm just going to put in the chat box some links to this stuff I've just been talking about, okay? Because I'm skipping through this quite quickly, I appreciate. And I think so what I've done is in the chat box there, I've put some links to some of the stuff I'm talking about. So I'm just going to return to the screen share a minute and come back to that. Just bear with me. Oh. Okay. Now, what I'm trying to show you is that recently in The Guardian, oh, why has it done that? Oh, I see. Recently in The Guardian, there's some information came out about the COVID death rate for men from ethnic minorities. And interestingly, it said that the death rate in the second wave for Black African and African Caribbean men had actually dropped right down towards their white counterparts. Whereas for the Bangladeshi men, it had remained just as bad. And for Pakistani men, the death rate had almost doubled. So they're just a sort of interesting stats there, but there's a link to that article in the chat box if you're interested. Other emerging issues, as we can imagine, and you know, this is typical across all genders, I know, and it's isolation, it's anxiety, it's digital exclusion, and it's domestic abuse as well, getting reports of that as well. In terms of digital inclusion, I'm happy to say that the Barker project where they're giving tablets to men, they're expected to have to give a lot of volunteer support to these men using their tablets for the first time. So the good news is that an awful lot of these men only needed 1 or 2 sessions, if that, and they were happy away on the tablets. So I just thought it was quite interesting that, you know, maybe we sort of sometimes can underestimate the abilities of, I certainly did. I thought people would need more support than that, having taught IT in the past as well, but it seems like these devices are quite intuitive for them. Another issue that's been brought to my attention from our friends over at the Council Public Health team is that men are not accessing the grief and loss services at all, hardly at all. It's a real big gap there. Given that separation and mental health and suicide and bereavement obviously they're all closely linked. And so if you've got men that you believe aren't able to open up about grief and loss, then there's an email address there. If you get in touch with Leeds Bereavement Forum, and they'll be able to put in to help you out there with your approach. Okay, so just moving on then. These next few slides are about some activities going on at the moment that are quite upcoming. I know you've all got stuff going on now. You're going to have a chance to do a bit of networking in the workshops you go to, rather than all of us sit around and listen to 25 people give an update on what they're up to. By going into the different workshops, you'll be able to meet each other then and network within then and talk about what you're doing. If you've got any activities that you want promoting to the wider network, please do send them to me by the end of this week, because I am compiling a newsletter of all this stuff you're about to see, all the stuff you want to send me, and anything else that comes out of this meeting. And I'll be sending it out to everyone as soon as I can get it all together and send it out. Okay, so if your stuff isn't on there, don't worry. I do want to promote it. I'll do it via the newsletter and via our webpage. Okay, but just to let you know, in the meantime, there is some of this stuff going on. So you can see here, domestic abuse training, Leeds dads doing some hairdressing for you, with your kids sessions. Okay, maybe you can have a go at trimming your own as well if you feel like you've got a bit too much lockdown hair yourself. There are grants for cycling and walking. Deadline's 19th of March on there, so I'm flagging that up. And that's targeting men as well. So grants for cycling and walking there. Again, these links should be in the chat box. I'll double check that when I come out of this screen share and make sure that all the links are in there. The performance ensemble are gathering. Is my box in the way there? Just wonder if I'll shove that out there. The performance ensemble are collecting 1,000 voices. They particularly want men to contribute and do any sort of performance with them. They'll get in touch with them and just eke out some sort of creativity and performance from them. They want to collect 1,000 voices to present at Leeds 2023. If you want to find out more details, again, have a look in the chat box for the link. Okay, oops. Rapid testing for key workers is available, even if asymptomatic. Okay, so that's yes, it's already at Leeds, Beckett, and at Gipton, but also it's now opened at Headingley campus at Leeds Beckett University up on Otley Road. Okay, again, more that's the info is in the chat box. Last couple now, ladies and gentlemen. Magpie are doing some research into the 5 ways to well-being. There are the 5 ways on the left there. Okay, so this is a really useful tool, I find, for measuring where someone is at in terms of sort of participation, community, society, how they feel included and things, and just obviously their well-being. So the public health are looking to sort of tie in a lot of stuff with this. They're looking to see how you might use this in your work, and if there's some mileage for sort of building future projects, if you like, around this whole notion. I know there's myself and I know at least one other person in this meeting now have used this in their work. They're doing some research. It's a very short survey, about 5-minute survey. I've done it myself. If you've got time, just have a look at that and see if you might be able to help them out and working out whether this is a good thing to do or not. Okay. Leeds museums are holding some virtual sessions in the 1950s and 1960s. You've got any sort of men's groups you think might be interested in getting involved with that? Contact Patrick Bourne. And that's it. Okay. So there we are. I tried not to do death by PowerPoint now. I tried my best. The idea being is that you can revisit, because of the wonders of technology, you will be able to come back to this information at your leisure, and it's all in there. It's all in the chat box. Okay, so I hope that was useful. Anyway, that's a bit of a lightning tour. You've all listened very nicely. Thank you very much. I'd just like to add, so shortly we'll be going to the workshops. I'm just going to now, if I may, share with you the evaluation that I would love it if you could do for us, please. Okay, and then we'll go and have a little chat about the workshops and take you into the workshops. Okay, so let me just find the link, and what I'll do is I shall talk you through the link. So if it's all right with you guys, oh, I've sent that to Gabrielle. Beg your pardon. Gabrielle just sent me a message, and I've just sent the chat box stuff to her by accident. Right, there we go. Right, so if it's all right with you, I'll just walk through it with you now. Okay. Before I go on, are there any questions about anything you've just seen? I appreciate it's quite quick, but are there any questions at this stage?
Yeah, I had a question. I might have missed it in terms of the format. Are we going to get a chance to hear, because we're going into workshops soon, aren't we? We're going to get a chance to have a bit of a quick intro from everyone, just to hear where they're from and what they're...
Yeah, sorry, I should have said that. It's a very good point, actually. Yeah, so...
Because this is my first time attending this. So
no,
sure
don't worry.
People won't know.
You're quite right. There's a lot of people who don't know each other. And I should have said that in the workshop meetings, that's when you get... I'll give people a chance to go around and introduce yourself and say what you're doing. The reason I'm avoiding it now is just because the sheer amount of time that's going to take. I suppose the way to see it is, if you see this as like a hall where we've all come in and there's some seats around and we've all sat down at the seats, and and we're just hearing a bit of an initial presentation and stuff. And the way to see the workshops would be a room and there's just a circle of chairs and people are sat around, and I'm trying to make sure that I want it to be very informal, and certainly in terms of the people who are at the workshop. I've just realised that one of the ladies who's doing the workshop isn't here actually. Right, okay. Anyway, I'll call her in a minute. Yeah, so it's just the people who are running the workshops, they're not necessarily facilitated teachers or anything like that. They've come to share their skills with you, and just let you know, for a lot of them, they just let you know what they know. And the idea is, this is a collaborative meeting where you hear what they've got to say, then you give your views and your ideas on what you're doing. Okay, so okay, so I'm going to just guide you through the main survey now. Copy hyperlink. Right, so if it's all right with you guys, if you can click on that link I've just put in the chat box, and I can walk you through that, that'll be great. Okay. So the first question is, in what words, in 3 words, what does mental health unlock network mean to you? So for example, it might mean to you, I say words, you might mean to you networking, for example. It might be at the moment, it might be strange, might be, if you've not been before. It might be useful, it might be whatever it is, whatever the, if you can think of 3 words to say what, just tap them in.
It's saying that you need permission to access the.
Is it? Is it really?
Yeah, I've got the same, Damien.
Have you? I tested this earlier. Ah, right.
It just says you need permission. This form can only be viewed by users in the owner's organisation.
Right, okay.
Perhaps you could email it to us afterwards.
Yeah, I think I'll have to, won't I? Yes.
Yeah, Damien, if you send me a link to it, there might be a way of changing the permissions, and then we could send it afterwards.
Yeah, that'd be good. Thank you.
I know how to do this because I did this last week with a form of my own. If you click on the little, it isn't on the sharing settings, it's on the little cog, and there's a thing that says this can only be accessed by members of Forum Central, and untick that box. It just defaults to that box.
Right. Okay. It's funny because I did test this, but you know what I did? I tested it with a member of Forum Central. So I reckon that's why, and that it worked for them. Right. Okay. So, spare me. In the, what do you say, Duncan? In the cog?
Yeah, click on the cog.
And untick restrict to users.
Yeah. Then
right.
Duncan, then if everyone clicks on the same link again, it should work.
Go on, does it?
Yes.
Duncan, a bottle of champagne is on its way to you as we speak. Right. Oh, okay. Right. Good, dear. Right. Right. So, thank you, Duncan. Okay. So, let's see then. In 3 words, what does mental health and lot mean to you? Inaccessible might be one, I suppose. So but no. So what it means to you. So it might be useful, might not be useful. You know, I don't want to put words. I'd like to give examples, but I kind of don't want to put words in your mouth. So I'll just let you answer that. And thanks, guys. Right, sorry, got distracted then. So you might you might go on to the next question, which is, what would you like it to be? What would you like mental health unlocked to be? Okay, which is kind of the more important. Well, anyway, what would you like it to be? It might be what it already is to you. I don't know. You know, I think for me, I would put, I want it to be collaborative. I want it to be a learning environment. And I want it to be useful. I think there'd be my 3. Okay. Next one is, how helpful has Mental Health Unlocked been for your work since the launch with men, since we launched in November? Okay, so has it been not useful at all, extremely useful, or anything in between? Okay. And obviously, if it's the first time you ever heard of it, you would just put not useful at all, and don't worry, I won't take it personally. Okay. Or maybe it's useful in this very moment, I suppose. Anyway, the next question, in what way has it been useful? Please tick all of those that apply. Okay, I will read them out just in case there's any language issues going on there. So in what way has it helped? So has it linked you with other, I'll read them out. Linked me with other organisations, linked me with other organisations, and this has resulted in us doing some work together with other organisations. delivered activities for my clients or for men that I know, given me support, advice or information on working with men, made me aware of funding available, has raised the profile of men's health and well-being across the city, or I have used the What's On listing for men's activities in Leeds. Okay. Or anything else that you think that in any other way Men's Health Unlocked has helped you. Okay. And then there's a list there. Ooh, it's a bit messy. What would you and your organisation find most useful? So just tick any of these that apply. So regular network meetings, yes, definitely, or no, probably not. Work now, a word of warning there. 1 is yes, definitely, and 5 is not. Okay, not sure how that happened, but 1 is yes, definitely. So if regular network meetings are definitely very, very useful, tick 1. If they're not useful at all, tick 5. Okay, so 1 as in Christmas number 1. 1 is the best. Okay. Okay. Could I ask people to mute their mics as well, please? Sorry, thank you. And workshops, are they useful? Then the next one down is newsletters. Then you've got information on men's health and well-being, tips and advice on how to engage with men, funding information, a what's on for men in Leeds, and easy to access micro grants they're like for small organisations, you know, so it could be like Jim and Abdul on the allotment and they've got a little shed and they meet there and they think they want to invite a couple more men down and they want to get a little mini men's group together, you know, sort of things that can easily be accessed by at the very grassroots level to start building something. Okay. And then there's a space to put in any other ideas. We're nearly there, ladies and gentlemen, we're nearly there. So anything else that you would like, anything else that you found useful for you and your organisation for Men's Health Unlocked, put in that box below that grid. And then finally, is this your first time at a Men's Health Unlocked network meeting? Okay. If you're able to put your name and organisation and, well, name and email particularly, then that would be great to let us know who you are. Okay. Looking at the screen, you're all done. You're all sat there looking at. See, I wasn't looking at. I can see all your faces now, and you look like you're pretty much done there. So lovely. Right. Well, thank you for taking part in that. Right. Okay. We're going to move on to the workshops now. So this is your chance. You'll get to meet other people with a similar interest. You'll get to hear the person talking about what they're talking about. So we've got great group activities with Tara Scott from Zest Leeds. We've got Men and Self-Identity with Duncan Millard from Humans Being. We've got Dr. Mike Jestico from University of Leeds. He's looking at notions of health and well-being amongst low-income men. He did a lot of that research for that in Leeds with some men's groups in Leeds. And the other one is working with ethnic minority men with Geeta Lota from Circles of Life, Voices of Men. I should add for that one, I don't think I gave it a brilliant title, to be honest. Just so you know, it's, you know, working, you just go and talk in some ways, working with ethnic minority, well, go and work with them. That's how you work with ethnic minority men, go and work with them. But Geeta's got loads of experience in the stuff that she has been doing and loads of different men she's been working with. And she's got some, you know, so she can talk about what she's been doing there. And as with her workshop, and as with all these workshops, it's your chance to contribute too. Okay, this is about sharing. There are issues for men's health. We want to find out how to work, how to address them, and this is how we find out, by talking with each other. And as I said in the last meeting, we tell our men it's okay not to be okay. Well, it's all right. It's okay for us to be wrong as well. It's all right for you to be wrong. Please be kind and be useful. for yourself. That's borrowing slung lows phrase, which I absolutely love. It sums up a really great attitude to be kind, be useful. And if someone else is saying something you don't totally agree with, or you think they've used words that you might find offensive, please be kind to them. They're probably only trying to be useful. Okay. And they're probably trying to be kind as well, probably. So anyway, there we are. So right, I'll send you off. I've stopped talking now. I'm going to send you off to your workshops and let these experts do their talking. So Kelly, I've put people into different rooms under auto assign. I'm not quite sure how to press fire to make everyone disappear into them.
Have you added them in the breakout rooms?
I have, yes. Now,
right, okay. And everyone's where they need to be.
Not everyone. There'll be a couple who aren't assigned, so don't worry. This is a good point. I will still be here with Dr. Jestico's workshop. Will be taking place in this main room that we're all sat in now. So if you've not been assigned, you'll be in the main room. I'll make sure I assign you to whatever workshop you want to be in. Okay. If you're in the wrong workshop, just leave, come back here, and I'll show you to the right one. So there's no sweat, it's no problem. Just take your time, and we'll see you after the workshops. Okay. Thank you, Kelly. Could you press fire, please, or whatever it is?
I made you the full-on host.
Oh, right. Okay.
So you should be able to press fire. And if you scroll to the bottom of where you've added people, there should be a button to press.
The button to press. That's probably a nice way of saying it, isn't it? But scroll to on the Zoom web page, or breakout rooms.
Yeah, in that section. Yeah.
Thank you very much. Right. Are they going? Is everyone going? Is it working?
People appear to be moving somewhere, yeah.
Good.
I've not received an invite yet myself to a room.
Maybe not, right, okay. Not sure why.
No, I've not received anything either.
Right, Kelly, I'll definitely put you in one, but not try. I'll assign you. I can assign you now, can't I?
I need a sign-in as well, Damien.
That's weird. I thought I'd signed you as well. Never mind. Right. Okay.
I'm still in this room, Damien.
I definitely did you as well. That's right. Okay. Yeah. Well, there we are. Zoom technology. I'm still getting used to it, I guess. Right. Not to worry. I'll get you. Make sure I sign you now. Then.
I definitely shouldn't be here.
No.
Did you take them all? Yeah. All right. Yeah. How is it?
I can't find where to put people in their rooms, Kelly.
No.
If you want, you go on participants at the bottom. You can change me into a co-host. Oh no, is it in participants? One sec. Yeah, it should be, I think. You should be able to click on my name.
Make host.
And make me a, yeah.
Right.
Okay, I can see the breakout rooms. Yeah, there's lots of people, it says not joined. You said you added them to rooms.
I thought I had, yeah. Yeah, definitely.
Oh, right, okay. Is there a list of people at all that you can send me quickly and where they need to be?
No, unless I go, yes, there is in the actual Zoom account under the meeting details, if you look in there.
I'm supposed to be leading number 2, room 2, I think.
Is that men and self-identity?
Aye, that's me.
Right, okay. I'll add you to there then.
Thank you.
In the first instance. There we go.
Could you put Tara in room 1, please, Kelly, because she's leading that one.
1.
I'm in room 2 as well, Kelly, please.
Right, okay. I've just got a knock at the door, but I don't think it's important. Sorry. Right, okay. Room 2, so Adam wants to be in room 2. Jez, where did you say you were? Sorry.
Room 2 as well, please.
Right. Sorry, 1 second.
Ready up the door. There's somebody up the door.
I don't know why I can't.
Is it grot bags?
Yeah.
Those of a certain vintage will get that joke.
What are you trying to say, Ian? They're all being picked off one by
Sorry,
one.
I'm back now. I couldn't find a list in the Emma says room. I couldn't find a list in the Zoom, Damien.
Really? Right.
Yeah.
Okay. It's staring at, right. Never mind. If we can just go through each person. I know Hayley's in this room. David Smith. David, what room were you in, please?
With Tara, please.
That's room 1. Mike, you're in this
David
room.
Smith in room 1.
Yes, please. Mike, you're in this room. Gabrielle, I've got here. Gabrielle, what workshop are you doing?
I was workshop 1.
With Geeta.
Oh, sorry, Gabby. I've got different Gabrielle. But sorry.
Sorry.
Gabrielle, what did you say? Sorry.
It's only Gabrielle on a weekend.
What would you like to be called?
Gabriel or Gabe.
Sorry. Right. Gabriel, what room would you like?
With Geeta, please.
Which one was that? Sorry.
That's room 3.
3.
Well,
Okay.
could you put Circles of Life? That's Geeta. Could you put her in room 3 as well now, please?
Yes.
Right. Mary, which room are you, please? 2. Room 2, please.
Lovely.
Mary. Is it Cuff? Is that how you say your name, sir?
Yeah, Ansel.
Ansel, hello, sir. Right, thank you. What workshop would you like to do?
I have not seen any details of any workshop on my screen, so I don't know what workshops are going on.
Okay. Would you like to hear about Circles of Life and their work with ethnic minorities? Would you like to hear about great group activities, men and self-identity, or men's low-income men and their notions of healthy and unhealthy?
Low-income men.
Okay, that's this room. Brilliant. Okay, Lawrence?
I'm with Geeta, please.
Room 3, please.
Okay.
Ian?
The race one.
Room 3, please, for Ian Pepper as well, Kelly, if you're ready.
Yeah.
Peter, trainer?
Yeah, I was in the activities one.
That's room 1,
Activities for
please.
men.
Room 1.
Lovely.
Right, thank you.
Emma?
Yeah, Damien, can I stay here now? Tara's sent me back. She's fed up of me, obviously.
Other Emma?
I don't mind. I was originally workshop 4, so I
That's
don't really
this one.
mind where I go.
Okay, well, that's this one. For bureaucratic purposes. Okay, Gabby?
I was in the group activities one.
Room 1, please, for Gabby, Kelly. See, best laid plans and all that. Ali?
I'm in this one.
Lovely. Mick Howard?
Room 4.
That's this one.
Yeah.
Abdullah, sorry, did you tell me? I can't remember what you said. Sorry, Abdullah. It's not it. Maybe it's coming back. Zoe, are you with us? Oh, sorry, Abdullah, yes.
Yeah, can I ethnic minority men workshop,
Sure.
please?
Room 3, please, Kelly.
Yeah.
Zoe, are you here? Yeah, great. Shane, which one would you like to go in?
I'll go into the activities one, please.
Room 1, please, for Shane. Zoe, do you let me know if you want to go in a different room, Zoe. Is that everyone?
Yeah, I think I just have to join room 1, don't I?
You do, yeah. Thanks, Kelly. Let's. Oh, how do I? Oh, hopefully, Hopefully
Yeah.
I won't-
Are
how do
you
I-
are you still a host, Damien, or not? I'll have a look because I'll make you a co-host to make sure you can close the rooms if you need to.
So how do I? Okay, where do I?
I've made you a co-host, so that means when you want to close the rooms, you can just go in breakout rooms and click close all rooms.
Okay, and can I assign people to workshops if they turn up late?
I'm pretty sure you can, yeah, but give me a ring if you have any issues.
Will do. Okay, thank you, Kelly.
Okay,
Right.
no worries. Hello.
Hi, Kelly.
Hi, sorry, it took me a while to join there. I was individually adding people to the rooms. Something's gone awry with the breakout rooms. So sorry about that.
Is it sorted now, or should we wait a few minutes?
No, I was the last one to join. I was just making sure it was all in order before I left.
Right. Well, we haven't started. We were hanging on, so.
Oh, thanks for waiting.
So I'll kick off. So my name is Tara Scott. I'm the communities team leader for Zest, which is a charity based in the old Gipton fire station. Zest has been running since 2002. So it's for 18 years now, probably. Is that right? 2002? 19 years this year. And I've been with them for 14 this year. So I've been there a long time. We started doing, so basically Zest is one of the Orion partners with Space 2, Feel Good Factor, Shantona and Touchstone. And I'm sure you've heard of one or more of those. So our main aim is to reduce health inequalities in Leeds. And that's not just with men, that's with anybody above the age of 16. 6 years ago, we're mainly public health funded. A lot of our colleagues are public health, but then we're also funded by the Lottery, Henry Smith, and other little pots of funding from the council. So yeah, 6 years ago, our public health funding, before that we were getting funding to do quite a bit of food work. But then we opened Jamie's Ministry of Food in Leeds Market. So we were already covering that base. And that was around the time where public health were realising the inequalities in men and that they weren't accessing services. We would run a community group in a community centre, no men would attend. So then it was about 6-7 years ago, we got some funding. I was working with Damien on that actually, to do some men's work. So that's when we started with the men's work. I've been running the Gipton men's group for quite a lot of years. And then when that funding ended, we got some funding for a specific men's worker just to work on men's health. That post ran out in November, and it was one of my team who was running that, but she left just before COVID. She got a new job, so I was sort of thrown into that role as well. That funding came to an end in November, but we've just found out we've been successful and we've got another 3 years to deliver men's work, full-time worker. So at the moment, we've got 5 men's groups. So we've got one in Seacroft, one in Gipton, 2 in Seacroft, 1 in Gipton. We've got 1 at the old fire station. We've just finished doing Men That Munch, which was a cooking project at the Leeds Cookery School. And we've got a group called Impact, which is a group of men who come together, there's 6 of them, they come together to try and work out how so they're like Manbassadors, how they can help other men and be peer support to other men. Obviously, we've been in lockdown, so that hasn't been brilliant because 2 of them just refused to go on Zoom. Yeah, so I'm here today just to talk about men's activities and how we can just share ideas about how we engage men and what works and what doesn't work. And I'll just share a few of mine, and then can we discuss them? Then you'll give me some ideas about what you do and what works well. Yeah. So number one is cooking. We always get men through the door. We did find out when public health said that men weren't attending community events or community groups, and they weren't engaging, that they were actually engaging in our Ministry of Food in the market. That was more or less 50-50, men and women. And that's the only place we found that. So cooking's a good one. We have had funding to do Men That Munch, which was some 8-week cooking courses at the old fire station. So the men would all come together, cook a meal together, and then sit and eat lunch together. That's been really, really successful. I think we had 40 something men through. Eating, that's another one, how I managed to get men through the door. So when I first started the Gipton Men's Group 5-6 years ago, we were advertising, we were flyering. There weren't these men's networks about them, which they are now. And it was just a very, very slow process. So we did something which goes against our ethos at Zest, which is offered out bacon sandwiches, because we are a healthy living charity. But we decided that them having a bacon sandwich is going to be less risk to their health than them being isolated and being at home. So we put on the leaflet, come down for a chat, bacon sandwich, cup of tea. We got people through the door. And we find once men do start coming to a group, it's very, very rare they don't come back. We don't get a lot of drop-offs. So it's just mainly, as you all know, it's getting them through the door. And once they're through the door, it's quite easy to keep them because they realise that, you know, that is what they need. Northern College.
We cut short because we've got to get all the way around the room. And if we've got any time, we can come back to you, Tara.
Yeah, that's fine. I'm just going to give you, Damien just asked me to give you a few things which we know would work, and then I'll come to you guys. Is that all right?
Yeah, but it's been quite long.
Yeah. Northern College is another brilliant one. The men get to go for a weekend, to learn a skill, and to them it's like holiday because a lot of them are isolated. They live alone and they don't get to go anywhere. It's free if you're on benefits. They get the meals included, and it's in beautiful Wentworth Castle grounds. Walking, craft, painting.
What was it called?
Sorry, what was that called?
It's Northern College in Barnsley.
Northern College. Thank you.
Yeah. Right, so I'm aware I might be talking a bit too much. So Gabby, is there anything you'd like to add or ask?
Yeah, sure. So we run a men's walking group. Hi, I'm Gabby. I'll do the whole intro bit. I'm a support worker at New Wortley Community Association. And currently for men, we are running a men's walking group. Sort of lockdown, the amount of men that came sort of dropped off, but over the second lockdown, it's actually increased. And I went out with the men on Friday, and there was 7 or 8 men there. And on that, as well as you're saying about the sort of offering food, they get offered a hot drink and a like takeaway. Obviously, everything's takeaway at the minute, like a takeaway sandwich and stuff. But that's going down a treat. John Battle runs that, who's an old MP. I don't know if any rings a name at the bell. Name rings a bell, but he takes them out on like 3-hour hikes sometimes. So that's working out really well.
Where are you from? Sorry, Gabby. Which organisation?
New Wortley Community Association.
Right. Okay.
We also have an urban task force, which is a practical outdoor group that runs every Tuesday and Wednesday. That is open to males and females, but due to the nature of the work, it's usually males. And again, another hook, like you said, offering a sandwich and a hot drink at the end of the day. Sorry, just dropped my pen. But that seems to be going really well. We get a lot of calls from sort of local councillors or schools who want their areas tidying up. So the urban task force go out and do that. We spoke to Mark about this last time, actually. We are hoping to have a coffee morning running in the centre, open to males and females, but we've just this week started that up on Zoom. But it is quite hard to engage people over Zoom, as you said. People might not have access to it, or it can be quite a difficult situation to be put in where only one person can chat at the time. So we're just sort of holding on till April, May, when we can get that properly in the centre. But yeah, that's about what we run, and I think I do agree about the food element as a sort of bribe.
It's health by stealth, isn't it?
Yeah.
Sneak in and then give them all the health messages when they don't realise it. Mark, do you want to introduce yourself and what you do?
Yeah, Mark Clayton, 70 years young. I'm bipolar, 11 years into recovery. I've been in Leeds 6 years. I'm heavily involved with LYPFT, everything from being a governor to their patient participation group.
What does that stand for, sorry?
Sorry?
What organisation was that?
Leeds and York Foundation Partnership Trust, the mental health trust in Leeds.
Right, thank you.
I have done, prior to Leeds, I lived in Aberdeen. I set up a thing called the Bipolar Brigade for men with bipolar. And we ended up with a lot of ex-army types who had post-traumatic stress disorder. It's slightly different. Came to Leeds, I've been learning what sort of things. So I've set up, I'm starting my own outlet, which is called Talking Sheds, which has 3 elements. The first element is to build a shed on an allotment. The second element is to make some food. And the third element is to have some facilitated discussion, to move people towards, I've forgotten the words, long-term employment or fulfilled, having a fulfilled life, whether that be only going to 2 events or going to less. It's only open to men over 55 single, because they're the worst cohort for suicide. Phase 2, which I will be running, I'll be collecting the evidence base from phase 1 so that I can go to the CCG and ask for £250,000 to run the project over 5 years, 6 outdoor and 2 indoor activities over the year, and then over 5 years do the same thing, so that we've got some continuity. Because if you're going to move from the, 5 times worse than the norm for suicide in older men, you've got to do it over quite a long period of time and build up confidence so that people will believe you.
Yeah.
So it's going to take a lot of my time at the moment.
Sounds very interesting. Good luck with the funding.
I've done funding before.
Yeah, I hope you get it.
Yeah, thank you.
You're welcome. Peter?
Take myself off mute. Good afternoon, everybody. Hope you're all well. I'm Peter Rawlings. I work for an organisation, Leeds Irish Sheltered Homes. We essentially support the Irish community within Leeds, combating social isolation and loneliness. I'm currently doing a men's Zoom session at the moment, a Friday Zoom session, men's group. And it's quite an informal session that we hold at the moment. It's kind of anything that anybody wants to bring to the table. So we don't structure it too much, but we had a structured session a couple of weeks ago. A gentleman from the NHS Cancer Support Trust talks about the early onsets of cancer and the warning signs and things, which was fascinating. Very, very interesting.
Was that Darren?
It was, yeah. So, he's a good friend of mine, is Darren. I've known him
He's
for
a lovely lad, isn't he?
Yeah, he's all right. He's a bit of a peacock, but he's all right. You'll know that one.
He's always spotlessly dressed, isn't he?
Oh, yes.
Looks like he's going to a posh restaurant for dinner every time I see him.
Yeah. So, so we had that session. Again, I think through lockdown, we've been not just looking at the physical impact, but the mental health impact it's had on, well, not just on everybody really, including staff. I think, it's just about sort of identifying and recognising that, and I think we've all had to kind of adapt to this sort of pandemic, and I think the digital inclusion side of things has been phenomenal. Again, our organisation is part of this process, sort of borrowing tablets and teaching people how to use this, which has been a massive thing. So some of our gents have got involved with that side of things. Prior to lockdown, I was involved. I don't know if you've heard of it. It's it's a charity called Canal Connections, based down at Thwaites Mills. A gentleman called Alan Bolton that runs the session. We were doing a men's group, like-minded gentlemen, sort of middle-aged chaps, going down, having a day on the canal boat. And there was so much more to this. It was kind of structured where, if the gents wanted, they could volunteer themselves to actually learn to navigate the boats and become volunteers to maintain. So if the gents have got a retired and got a skill set of your joinery, for example, they could come down and lend their talents to keep the boats afloat, if you will. But we're waiting for that to come back into play. I'm just currently, as we speak, I'm doing a funding bid, for some bikes. So we're looking to hopefully, through the City Connect, putting a funding bid together to try and get a few bikes so we can get a men's group going. Because where we're situated, we're down in Kirkstall, right by the canal, which and the plan would be, it's a big plan, but to do a cycle down the canal to the Canal Connections, go for the day on the boat and then come back on the bikes, so it'll be fully rounded sort of thing we've got, we could put together. So we've got a few ideas and thoughts, putting men's groups, walking groups together and things. We did used to have an allotment, which we need to try and follow that up again, So there's been a lot of things, but we're kind of, we have a lot of gents, they have a lot of underlying health conditions, the people that we work with. So there a lot of people is continuing to shield that we need to be aware of. So when things do ease and, we do eventually get out of this nightmare, we're going to be looking to put walking groups, cycling groups, if we get the funding, and just sort of move forward from there, really. That's kind of what we do.
Sounds great, and I'm going to apply for that funding, but for walking, because I can't ride a bike with my knees.
Yeah, well, it's there's a pot there, isn't it? I might as well try and or get a bit for to serve the cause, really. But that's about. I don't want to keep much more time because I'm mindful there's other people to get through.
Then do you know John Wall then?
Yeah.
He's one of mine. Is he on Zoom?
He is, yeah. That's me anyway, guys. So
right, brilliant. Thank you, Shane.
Hi guys. Yeah, so my name's Shane. I'm actually from Kirk. I'm outside Leeds. I'm from Kirklees. I don't know if that matters, but I saw obviously this advertised, and the manager said would it be interesting going. So I work for Kirklees. I've got kind of two reasons why I'm here. I work for Kirklees Council as like a community coordinator. So I work with individuals, both men and women, but kind of signposting them into individual activities. And some groups I work with, like Men's Shed. So we also work with groups as well. Again, things like people like Men's Shed, and they're looking to develop. So the idea of me coming along here was just to kind of pick up on things that they're running. Obviously, Men's Shed run like kind of joinery and joinery activities for men with mental health issues, and but they're also looking to do activities, additional activities. So things like what you've mentioned there, like walking groups and cooking, because it only happens once a week. Obviously, they're wanting to try put more provision on. So that's kind of come from Kirklees Council Community Plus side, and what I do. But then I'm also outside of work. I'm involved in an organisation called the Here to Help Hub, H2HH Hub in Dewsbury. and that's supporting both men and women, but around mental health. And that started up in July last year, and we're seeing a lot of people come through the door. And we run one-to-one stuff, and we run group sessions. So we have a couple of counsellors that will give advice and guidance around the work on one-to-one with people. Then we run a group session, which we're looking to extend that to 2 group sessions. And we've got a bit of a pathway where people come through that pathway. And then we're looking to develop the organisation in terms of, like, again, into activities. So things like walking groups, cooking, and then also we signpost people onto worklessness programs and stuff like that. And we've had some good successes in a short space of time, really. And it's just growing and growing. We're looking to do some work with Rugby League Cares. And then a couple of kind of business organisations such as like Sandwich King. I think that's your way in Leeds. Because the guys that run the organisation, myself included, have all had their own struggles and mental health issues themselves. And organisations are wanting us to come out and do talks, and as in kind of real people that's been through real life situations, and open that they can then kind of people then come forward through the organisations that are struggling, and we can kind of support them as well. So that's the reason why kind of I'm here, really, just to find out a little bit more about what activities are going on in the area, not just Kirklees wide, but obviously we're Yorkshire wide as well, and ideas and stuff like that. I'm picking up, see if we can pick up on ideas and share them ideas as well.
Brilliant.
So,
have you heard of Jamie's Ministry of Food in Leeds Market?
I hadn't until today. I've heard of the Real Junk Food Project in Leeds.
Yeah, that's brilliant as well. So we run Jamie's Ministry of Food in Leeds Market. They always also do sessions at the fire station. They've been going 10 years now, but they let you do group bookings, and if you're on benefits, it's £2 a session.
Right.
And I mean, it might be a bit of a day out as well, going to Leeds for a day. So it's an 8-week course.
Right.
£2 a session, but they get all those ingredients. What they've made, they got all the ingredients provided, and what they've made they can take home and eat later. So that's really popular. So that might be a good idea for your cooking if you don't fancy doing it yourself.
I've been doing a lot of cooking in this lockdown.
My son's just got a flat and his no cooker, so I've just done loads of batch cooking this weekend. And then last night I was so tired I had a toastie because I couldn't be bothered cooking it.
Can I just ask, is everybody obviously on this call? Is everybody from Leeds on this Unlocked Mental? Is everybody Leeds based?
I think so.
Yeah.
Yeah.
It sounds like it. Yeah.
Yeah. Thank you.
All right. Thanks.
Peter Trainer.
Hello.
My headband buddy.
Yeah, well, I've got, funnily enough, a few hats on today. So I come partly representing Leeds Dads groups, which is, I think, one of the biggest dads groups in the country. I've been working with them for about 7 years now, or been a member of them since my daughter was born, basically. And we recently took on the role of chair of the online wellbeing support group, and we run a support session on Wednesday evenings on Facebook for Leeds Dads. Basically, it kind of became apparent even before lockdown that some dads were struggling with lots of issues. We had a dad who committed suicide a couple of years ago, and so I think it's been kind of building towards this. And then the lockdown, I think, really inspired us to start something. We've been doing that with Touchstone and Men's Health Unlocked. So they've been providing the kind of expertise and support of that. So I like the idea about talking about food, because we do I actually used to be a cook and trained as a cook, and I've done me and my daughter did the baking class at Leeds Cookery School just before lockdown.
Yeah.
It's fantastic. We had breakfast in Zest and everything. It was great.
Wow, brilliant.
But we do once a year, we cook for the local community around Chapeltown, and we get so many dads coming to help out. Like, actually too many dads. Like, everybody turns up for that every year. So I think there is something about cooking that does get men involved, absolutely. But I'm also here just with myself. I was a researcher for a long time and I lost my job last year. So I've been developing as a kind of mindfulness coach. I'm doing training and teaching Qigong and things. Really to older people is the idea. So I'm always open to networking and having conversations with people about health and well-being and, you know, finding some other outlets to do that kind of thing. So yeah, that's me really, yeah.
Thank you. I've heard a lot about Leeds dads. One of my team used to work with them, Natalie Davis.
Right, okay.
Yeah, she did a project.
Yeah, the name rings a bell. I mean, it's all driven by Errol. I just do a small part of it. Errol runs the whole thing and does an amazing job.
Brilliant. Yeah. Thank you. Have we got David?
Yes, thanks, Tara. Yes, I'm David Smith. I'm a trustee at Crossgates Good Neighbours. It's one of the Leeds Neighbourhood Network schemes. So it's a local older people's charity that's actually run by older people. I do some befriending with one of our schemes. The chap I'm with is a stroke survivor, and we used to go every week to Tara's Gipton men's group, didn't we, Tara?
Yeah.
Yeah, I'd like to amplify what Tara said. Yeah, there was a regular group there up to about 10 people, and they went every week because we got to know each other. And yes, Tara did lots of things with food. We made pasta, didn't we? We made frittata once.
Yeah,
Cooked it there and ate it ourselves for lunch there. Yes, and Tara took us out to Temple Newsham House once, didn't you, Tara?
Did you come on the beer tasting?
Yeah, it's good to get out. It's good to get out, really. So it'll be nice to get back to that. Yes, at Crossgates Good Neighbours, we've got quite a big digital offering. We've got a digital inclusion worker, so we're quite interested in this digital exclusion and inclusion, dichotomy, really. There are some people, as people have said, some people are never going to be able to use Zoom. Either they don't want to, or they won't be able to. And that's a big problem that's appeared in the lockdown, really, hasn't it? I don't know how you get over it, really.
I think a lot of it's just perseverance. Do you know Kevin?
Yes.
Oh, he's got a little Nokia phone. He insisted at the beginning of lockdown, he does not want to learn technology. He's happy with his 20-year-old Nokia phone. Do you know he's now got an iPhone and he's on Zoom?
Knowing Kevin, I can believe he would take it up very quickly, actually, even though he might not believe it himself.
Yeah, it's just perseverance, isn't it? And I think at the first lockdown, people didn't want to join Zoom because they thought it was going to be we'll be out in a month, I can cope with that. And then I think after the first lockdown, we came out, and then when they went back in, I think we thought, you know what, this is not ending anytime soon. And I think anytime soon. And I think they were just that desperate not to be on their own again for so long that they tried hard. They've wanted to come on. So
yeah, you're right. We have trained a lot of our members now to get on tablets and things, and they do really like it when they realize it's not all that difficult, and then when they realize what they can do with it. We got book clubs and all sorts of things going now.
Yeah, that's brilliant. Book club, that's a good idea. I've never heard of that one before on Zoom.
Yeah, yes. What happens is they're given a book to read, and then they get together and discuss it.
All right.
You get a particular book, and then you get together and discuss it. That sort of thing. And then we have a quiz every week, and things like that.
Brilliant. Thank you, David. I've got Kelly. Kelly, are you speaking?
Hiya, sorry. I don't have a whole lot to add myself. I work at Forum Central. I'm the administration officer. I've not been at Forum Central super long. In all honesty, my presence at this meeting is to kind of help facilitate, really. I don't work with kind of men directly or anything like that, but I do really think that cooking is a really good option, as everyone's talked about. Like, I used to work at a mental health service before I started working at Forum Central, and a lot of our service users accessed the Jamie's Ministry of Food, actually, and they'd attend it over and over again, like they really enjoyed it. So there is definitely something about that. And we did a lot of work with, I can't remember the name, the conservation charity.
Skeleton Grange.
No, it's one like Kirkstall kind of area, but I can't remember the name of it.
Hyde Park sauce.
It's
No,
not-
I don't
but
know.
anyway, I know that
Oh, Hollybush.
Hollybush, that's it, yeah. I know a lot of work around kind of gardening and conservation is really valuable as well, and was really popular. So I think anything where people can get their hands on and get involved, like that seems to work really well.
Yeah, Space 2 run a gardening group from the fire station, and there's 3 or 4 guys doing that now, and they absolutely love it, and they've become really good friends, and they've started going for walks and stuff together. It tends to be the older men, I think, you know, who've had gardens before, and now they're retired, and you know that their own garden might be a bit too much for them, but they come there and just do the little bits. But they're growing all sorts. They're growing sweet corn. It's like sweet corn. I thought that only grown. You don't do that in big fields.
That's very exciting, yeah, definitely.
What time do we have to leave this room?
So
or we just get kicked out.
Damien messaged me saying that so in about 5 minutes there's going to be a break for 5 minutes, and then we're reconvening to talk about everything at 25 minutes past.
Brilliant.
I've learned the value of food coming from all of you. Everybody talks that if there's food there and you can get it made, it's going to make a big difference. I've got the idea of, you know, building something, problem solving, all that sort of thing at the beginning helps people work together. But the food thing, I hadn't realised the significance of it. And that comes across really strong. So I've learned something very useful.
Ah, brilliant. Another thing about the food as well, Mark, is a lot of men who live on their own, they think they're not worth cooking a meal for themselves. So they'll just get a microwave meal. We found in lockdown as well, one of our guys, he went to that many groups, he used to eat out every day. And now he's been in lockdown. He gets the food parcel, but he said he's actually having to cook, so he's eating a lot better because they're giving him, they're quite good food parcels, and he gets chicken and loads of veg. And when I speak to him, he's cooking himself a proper dinner, whereas before he would have probably just gone to Tesco and got himself a microwave meal, but he can't. So he's using
a big thrust on serious people who are seriously mentally ill to get them to do their annual health check. And currently there's only about a 52% take up in Leeds. So we want to move that up to 90. And it's not just the health checks I'm interested in. It's the, you know, getting better exercise, better diet, and stopping smoking that are really going to make the big difference to the people. Also, like you're talking, if you can get men into groups or groups of male and female cooking, working together and doing these things, it'll be far better than just, you know, saying, right, here's an 8-week course in diet or cooking, goodbye. Yeah. The real need needs to come in a follow-on arrangement, like you're doing.
Yeah, and when people do go to Ministry of Food and they finish the course, they usually do get signpost. We try and signpost them to another group somewhere, you know, to do other things. We've had quite a few from Ministry of Food who've joined our groups, and it's all about signposting. We're lucky as like I say, I've been doing this job 14 years, and we always manage to keep getting the funding. So we work with some of my men's group. I've worked with them 5-6 years, so I know them. Whereas before it used to be you'd get funding for 6 months, you just start to make them connections, and then your funding would stop. But it don't work like behaviour change. Don't work like that, does it? It's all about
building trust.
And trust.
Trust is the thing to me.
Yeah, definitely.
Sorry, Tara, can I ask? I've actually never heard of the Jamie's Ministry of Food before. Do you take referrals? Like, what's the? How do you go about that?
So basically, it's for anybody. If you're on benefits, it's £2 a week. If you're not on benefits, it's £8 a week. So there's a massive difference. If they go on a Monday, they go every Monday for 8 weeks. They're open Monday to Saturday. so for people who work as well. And they cook a meal from scratch every week and then take that meal home. And
sorry,
every week as well, they'll give them nutritional advice. So one week they'll talk about, as they're cooking, so it's not a structured, very strict class. As they're cooking, they will talk about, oh, did you know we're cooking this by scratch? If you'd got it in a packet, this is how much salt and this is how much fat would have been in it. So they do give out a lot of health information as well.
Oh, amazing. Is it open to females as well? Or is
everybody over 16. Yeah, so just jump their number. Is it useful for me to give you Ministry of Food's number now while people are on?
I've just got them on Facebook. I've just
you've got it, yeah.
Searched them, and are they still running at the minute?
They're opening again on the 12th of April. But obviously that's going to be limited. I think it's to 5 people. They usually can get about 8 in there.
Yeah.
They're doing it on Zoom at the minute. They're doing some Zoom stuff. But I think the thing is, people don't want to be on Zoom, do they? They want to be. So the Cookery School and Ministry of Food are both opening again on 12th of April with limited numbers.
Great, thank you.
Right, is it break time, did you say, Kelly? Sorry, I don't want to...
I think it is break time now then, if that's all right with everyone, unless there's anything else anyone needs to add.
Does anybody want to ask anything? Mark, are you all right? Cool. Right,
I've learned a lot from this. You know,
oh, brilliant.
I might learn a little, but I've learned how, you know, if you don't keep on learning at 70, you die.
Well, that's what these meetings are about, David. It's about sharing information and talking and yeah. Brilliant.
It's reformed my thoughts.
I'm hungry now after all that talk of food. I ain't had lunch. So I will see you all in the main room. In what time did you say? 10 minutes, Kelly?
It's just a short break. It's just 5 minutes.
5 minutes, sorry.
Okay.
All right, thank you.
Thank you.
Bye.
Not beyond poverty to start with.
Right, okay.
So it kind of, that was the big one, and then everything else. I just focused on the positives because I wanted to fill in the gaps in the literature where there wasn't any positive, and it was all
right. Okay.
I just pushed the positive all the time.
Yeah. Okay, that makes sense. Okay. Thank you, Mike. That was really good.
Welcome. Thank you very much.
Yeah, thank you, Mike. It was amazing to hear that work. It's just so uplifting what you did, and yeah, thank you.
Thank you. Thank you very much.
Thank you, Mike. Brilliant. I think we're having a 5-minute break now, or at least you are. Better sit here and hold the thoughts. As well, we're reconvening at. We'll say reconvene at 2:30, okay? As people are still filing back in. So, okay, reconvene at 2:30. Okay, just 5 minutes later than I said. You okay, Ansel?
Yes, sir.
Yeah, cool. Yeah. I spoke to David. No, who did I speak to? Someone from Performance Ensemble. Is it David?
Alan.
Alan, thank you. Yeah.
Mm.
Yeah, he told me about your 1,000 voices thing, which I skitted over a bit in the talk, but I can put that in the newsletter, give it a bit more.
Okay.
Bit more if you can send me a little paragraph on it. In your words, or Alan can, that'd be really useful, because it'd be better in your words than in mine for sure, you know.
All right, okay then.
Yeah. Do you reckon, would you be able to get that to me in the next few days, please? Would that be possible?
I think so. I mean, I'll check with Alan what blurb he's got, because he might have specific blurb he wants to put out.
Of course.
But I kind of know what I'm going to be doing, which is collecting stories, really.
Yeah. Yeah. Brilliant. Yeah. Okay. Well, I'm just going to get a glass of water. I'm back here shortly.
Okay. All right. I think I'll do the same.
Ah.
Damien, do you want me to, there's still some people in breakout rooms. Do you want me to just pop briefly in and
Yes,
let them
please.
know to
I've just
pop out?
told Geeta, I've just told room 3. If you can tell the other ones, that'd be great. Thank
Okay,
you.
cool.
To map out priorities, helping them to rethink about what is responsibility versus right, and allowing a person to say, well, you know something, even if you have to go back into a cultural tradition where you're not very comfortable, at least you can be comfortable in the space to speak to me. And that's all I can do. It's very complex and it's a conversation itself. So sorry to take so much time.
Thank you. I feel like we could go on about this for ages and ages. There's just one thing I want to say before we finish. It's really important whenever we're dealing with this, to look at the strengths as well, and that the whole man box thing, sometimes the stuff in there is good and sometimes it works for people. And here's a photo of traditional masculinity, perhaps. Got this off Twitter. It's from David Ampleforth, manager of 3rd Lanark AFC. Amateur football means a lot to me. I had a mental breakdown in 2015, relapse in 2016. Being surrounded by a group of mates who understand you is a great therapy. And I think we've always got to remember, we don't know what healthy masculinity looks like. It looks like all sorts of different stuff, and it doesn't. And as does toxic masculinity, and to look beyond those images. Thanks for chatting, everybody. It's been really good to meet you. Duncan Millard at humansbeing.org.uk. Please get in touch. We always work in partnership with people. We go to communities, we go to places, we run workshops, we run sessions, things like that, usually free because we get funded to do them. So if you want to do some work with me or get more involved somehow, get in touch.
Hi everyone, I've just popped in to say we're reconvening at past, so you've got a couple of minutes break before we reconvene again. So just letting you know about that.
Thanks,
Cheers, Kathy.
I didn't think you were in the room.
I'm going back. I'm just going to give it out.
I'm always, with the technical difficulties I've had at this meeting, I'm just I'm just delighted when anything comes, get some positive things back on something's gone right. So it's good.
It's always fun to see.
Yeah. Our one was good.
So in the same way, just going back to, Gabe touched on that, it's important as well. I suppose one of the things I've learned is trust, that is just, it's one-on-one. Yes, you can try and do things community level, but if you can work with someone on a one-to-one basis and help them know that you're there for them. I managed a cafe in Hare Hills for a year, pay as you feel cafe, and with quite a few refugees, asylum seekers, connections with Ritas and a few other organizations. And actually the relationships you build and the way that you help people, you encourage people to think that actually they can be here, they can enjoy their time here. When they arrived, they didn't have that understanding at all. They just saw the world as an oppressive place, that people wanted to get to know them, that people wanted to find out who they were so that they could put them down. By actually treating people just with a bit of trust, a bit of empathy, a bit of understanding, and then slowly you do whatever it is you do, and then you take people with you. But if I agree completely, Geeta, that, if you impose something, you're just like everyone else,
A meeting, do you see what I mean?
Yeah, or I guess you could send out like what we've done on this questionnaire thing, just hear what people would like really want to listen to, them onto that. See if there's like an overriding demographic of what people would want to kind of hear about.
Yeah. Yeah. Well, yeah. Go on.
I've just popped a message to Sarah in the remaining breakout room to let her know to wrap up. There was someone making a very important point that I didn't want to interrupt, but they should be back soon, hopefully.
Right, okay, cool. Thanks, Kelly. So, yeah, no, I'll wait.
When I've enjoyed or taken part in some work in, between Israelis and Palestinians and Jews and Muslims, again, I'm not going for the biggest changes in the world. I'm just going to make friends with one person to let them understand me, and so that I can understand them. And then you change the world one by one. It's great if you can do it more than that, but actually, rather than demonize people for just who they are, the Jews are this, the blacks are this, the gays are this, whatever it might be, men are this. Actually, one by one, we all have that duty to play. Sorry, I've talked for ages.
Yeah, it's totally how sort of prejudice breaks down, isn't it? Because it's that whole thing of, say if someone's homophobic or something, and they have like a gay workmate or a guy who they become friends with, and they find out they're gay, and they're like, oh, well, they're like, but you're all right, but you're all right. And then it sort of starts with, but you're okay.
Yeah.
And then it kind of broadens out. The logic sort of gradually falls apart, doesn't it? So you just kind of think, well, if they're okay and they're like that, then...
Right, guys, I'm so sorry to interrupt. See, this is me coming into the room, opening the doors. Yeah, we're all waiting for you, basically.
Oh,
okay.
Peace for half an hour, Emma.
They're coming.
Which room did you go into, Emma?
It was room 1. So it was about the research. It was really interesting.
Oh, cool.
So be warned, I'll be starting a photography project soon.
I'll be getting 100 emails now this afternoon.
Emma, just say the word photo elicitation to Tara after and see what face she pulls.
Oh yeah, Tara, they need those cameras back you've stolen.
What cameras?
I'm joking.
Have you got our cameras, Din?
No, I haven't. I've not got the cameras. Thank you very much. This is being recorded, by the way, Tara. Yeah.
I've not lied, Damien. I've not lied.
Right. Anyway, thanks everyone for coming back. I hope you enjoyed the workshops. I can't wait to hear all about them in a minute. First thing I'm going to ask you to do, though, is to click on the link in the chat box and give me a very quick evaluation of the workshop that you went to, and then we'll have a little chat about it afterwards. That'd be really helpful. It's in the chat there, so you just click on the form. It will take you, just tick which workshop you attended, please.
What, sorry? Where do we tick what workshop we attended?
Does it say workshop feedback?
Where's this?
Have you clicked on the link in the chat box?
Oh, right. Oh, yeah.
Okay. I'm sure you can work it out for yourselves. I don't think I need to handhold you through this.
Boom.
Oh, so remember 1 is extremely useful and 5 is not. So remember it's as in Christmas number 1. 1 is the best, okay? Just so you don't get muddled up. I'll just give another minute for that. So, one of the questions there was how was it for networking? I appreciate it probably wasn't that great for network. I'm not sure because of the late start. So sorry if you didn't get as much chance to network. This is a work in progress really, and I am gathering feedback on how and trying to shape this around what we need as a network, what we need these meetings to be. So your feedback is appreciated. Anyway, but before I do that, I think I really want to just go around and get a bit of an idea of the different workshops. So what I'm just going to quickly start off, because I was in workshop 4. That was with Mike Jestico, who's a doctor now based at University of Leeds. And basically, he was talking about his research he did with 19 or 21 men in Leeds, exploring their notions of health and well-being. And it was, he's come up with a new model of health and well-being, which is like health and well-being is a rock on a slope, okay? And the man or the person is there. If you leave that, if you don't do anything about your health and well-being, it will roll down the bottom of the slope. So you have to push your health and well-being up. And the things that help you push that health and well-being up are things like resilience, and I didn't write down the other things, Mike, sorry. And the things that push against it are things like poverty, for example, and space and time, I think, are other factors that push down on it. It's really interesting, and as particularly hearing about the men who had gone out with cameras photographing their notions of healthy and all the different things there. I don't want to go into it more than that, because I'll just end up repeating the workshop in a lot worse way than Mike would have done. So all I can say is I think a lot of us found it very, very interesting. I would really recommend you finding out more about this theory and the work behind it. If there's a way we can share it with you guys as a group, again, then I will very much look forward to doing that. Okay, so we've got different members of Forum Central staff in the workshops, so I'm going to go around them now. Sarah, what workshop were you in, and how was it, please? Just briefly.
Yeah, I was in Geeta's workshop on engaging men from culturally diverse backgrounds. It was really, really interesting. I'd find it so difficult to summarize the breadth of what we talked about, but we talked about a lot of common issues, distrust in certain communities and the very valid reasons why there is that distrust, and just ways to build that trust and engage communities in a culturally appropriate way, whilst also not generalizing groups as like a homogenous whole, because it's such an important balance to tread to make sure that services are appropriate, but also that we're not making generalizations. Geeta, is there anything else you'd like to add?
I think, sorry. Yeah, I think the group was brilliant. You know, there was quite a lot of questions. I'm looking forward to working in partnership with the members in our group, because I think it's vital for our groups that we're working with. The other thing is also, Damien, but you know, this platform is going to be absolutely brilliant for our diverse communities that we're going to be hopefully signposting to some of the services that you guys provide. In regards to Adam, I need to get in touch with Adam, because there's things that Adam, me and you need to get our heads together, because this is not just a one-man thing. We've got to work it together, because this is going to grow for us, definitely. Thank you.
Thank you, Geeta, and thank you, Sarah, as well. Jez, can you, and Jez, what workshop were you in again? Jez and Duncan, could you feedback, please?
Yeah, workshop 2, which was men and self-identity. The theme was masculinity and how we approached it in our work. So it was a really interesting workshop, and we had quite a sort of range of people in it. So it was interesting to hear where everyone had come from and their backgrounds. Duncan facilitated it really well. It was great. The opening thing was quite good. We talked about the top 10 images of masculinity on Google, which is well worth Googling if you've got the time, because it's quite funny. And then we talked about stereotyping, manning up, the man box. Duncan led us through some statistics on men's health, self-reliance versus seeking help, a video about challenging stereotypes. And then, I won't go into all the detail, but everyone went round and talked about how they've experienced conversations of helping the men that they work with get out of the man box. So that was really good. And then we finished just on a point from Duncan about that some of the stuff in the man box isn't unhealthy, and healthy masculinity is a wide-ranging thing. So that was our workshop.
Thanks, Jez. Do you want to add anything, Duncan, briefly?
I'd like to say that the contributions people made were really interesting about how for some people it's a lot easier to work kind of one-to-one with men. They can open up a little more. With other people that had more the experience of creating that peer support and mutual support made it easier for men to take support and to open up. Also, somebody talked about comedy and just irreverent banter and humor as a way of broaching difficult subjects and bringing men in, which I thought was great. So thank you, everybody.
Thanks, Duncan. Kelly, I'm going to come to you in a second. I realise I didn't ask Mike to add his to the workshop that I described. I beg your pardon, Mike. Have you got anything you'd like to add to the workshop that you ran?
Well, I need to fill in the rest of the gaps model if you want. So we're all on a journey with our health and well-being, from positive to negative, and we need to be in balance, be able to, as you said, push the rock up the hill towards good, positive health and well-being. The negatives, yes, spaces, unhealthy spaces, and unhealthy time, too much time or not enough time, and then we utilise our own resilience to help push the rock up the hill. We also have our own awareness of who we are and what is good and bad for us, and also external resources, things around us that we utilise as to increase our own strength, friends, family, spaces, places, religion, the things that give us strength from outside. That was the model. It looked prettier when I had the picture up, didn't it?
It was really interesting, and I'll share that picture and maybe just give a little brief summary in the newsletter that I'll send around in the post that I'd send around after this meeting as well. Okay.
Yeah, I thought the picture was good actually, and brought to mind that maybe you could have some formulas. Years ago, back in the 70s, I was in college and we used to do electronic formulas, and there was things like velocity plus mass equals force, and those kind of things you were doing look like that kind of formula. Maybe you could, I don't know, it could be interesting next time, do formulas about things that impact upon men's lives. You know what I mean? I don't know if it makes any sense what I just said to you, but yeah.
Yeah, thanks. Well, no, I like formulas and models for helping us. They're a checklist, if nothing else, aren't they, for what we do? Hopefully more than that. But anyway, I'm aware that Kelly's still got to feedback on her workshop with Tara as well. So over to you, Kelly.
Yes, so I was in Tara's workshop about great group activities. Tara made a good point that kind of the main thing you need to do often is get men in the door of getting involved in activities and groups, and once they're there, it's kind of often they'll stick around and keep attending. So that's really important. One of the main things we spoke about was how kind of food groups were really successful for men, kind of cooking, learning about nutrition. Tara helps run the Jamie's Ministry of Food group. And lots of other people also talked about how cooking had been really successful part of their work. Also, walking groups have been really successful, especially if there's like hot drink offers and like a kind of impetus behind people attending. Also kind of practical skills, like maybe working in gardens and allotments, kind of building together, cleaning up in communities are often really well attended by men, and helps them kind of build friendships and also helps their kind of health outcomes. As well, we kind of spoke about can't think of the word, digital exclusion, and how like a lot of people have been surprised that people have been able to join in online really well. We talked about as well, I'm just looking through my notes, sorry. At the end we kind of spoke about the need for kind of signposting after groups, making sure that once people leave a group, they don't just drop off and stop making those healthy changes in their lives. And we also talked about building trust and longer term relationships with attendees by like securing long-term funding and things like that. If there's any other points, Tara, that I've missed, feel free to chip in.
No, it was great because I just more or less facilitated, gave some suggestions of what works well for us, but then it was good to hear everybody else's ideas and what everybody else does, and I think we all sort of got something from it. But I do want to give a big shout out, because I know a lot of people don't know about it, to Northern College. That is one of the best things we've ever tapped into. And I've been going for since my kid, about 13 years. No, 16, 17 years I've been going. I went as a student for some short courses when my kids were little, but now I take all kinds of groups there. And men especially, they like it because they go into the classroom, they learn something. Quite a few of my men have got learning difficulties, they can't read or write properly, but they get a lot of support. And then they stay for like 2 days in their own little, it's like a little holiday. They think it's a holiday. So they've got their own room with their own TV and coffee making facilities, and they get all the meals provided. It's free of their own benefits. And it's based in Wentworth Castle Gardens, which people usually pay to go in there. They get use of all the gardens, which is stunning. There's an old castle ruin. You'll have been, Damien, I'm sure. But if anybody wants, to take guys, especially after lockdown, get them away from their houses, just look up Northern College, because it's brilliant. And they've got I can ring Louise and just say, right, these guys are interested in this, and then she will try and make up a course around that, so you don't have to stick with the courses which they offer.
I second you, Tara. Thank you. Yeah, definitely. I've been there myself as well, and it is really good. Very, very good there. Thank you, Tara, and thank you, everyone. Right, I'm going to round up now. I'm so acutely aware that I want more. Don't get me wrong, it's been a great meeting, and I'm so glad that the workshops are useful. I want more, because I want us to be able to talk to each other and find collaborations, and I feel frustrated that hasn't happened as much. I haven't given it, somehow we haven't allowed that opportunity as much as I would have liked, and I'm really, really keen to work out a way for this meeting to work better. A lot of people have said they wanted to go to 2 workshops. So how do I do that then? And do I get them to come back again? But that means another workshop that we haven't seen today can't come along. So any ideas that you've got, I can't have them now because we've got to finish soon. But any ideas that you've got about how to make this better for our network meeting, to be better for our work, then please do. You might be a volunteer worker, whoever you are, please do tell me. Before we go, I've got an old colleague of mine, Lawrence from Orion, has got something he'd like to share with you. They've been working the Manbassador project, which is working with businesses to support men who come into their shops and signpost them to activities. In fact, there's one of the Manbassadors is here today, Hayley Duffy. She's one of the Orion Manbassadors. She's giving a wave. Hiya, Hayley. Absolutely fantastic. She ran from Rodley to her work at the gym in town. Then she ran from there to Meanwood, to my house, to pick up some leaflets, to run back, to take back, to give out to the men back at the gym.
Town and run to yours.
Well, unfortunately, I didn't get a word about it. You're probably trying to be modest, but I won't let you. And entirely voluntarily as well. So anyway, Lawrence has got a poem from the projects they're doing. They've done a bit of a poem with the Manbassadors there. And I will just round up just after the poem to say thank you and things. But please stick around, Lawrence. And Lawrence also needs contributions, for the next edition of Unlocked magazine. He needs men's artwork. He's desperate for it. Poems, drawings, anything. Over to you, Lawrence.
Well, there you go. You've said it all. So it seems silly for me to sort of repeat that. But yeah, I'm editing the next edition that actually, sadly, is the last one, just that's the way things are funded, isn't it? We know that, you know, that's one of the problems in the third sector. So for the moment, Manbassadors will be on pause from April onwards. But the last edition, hopefully, I want to make it the biggest and the best. So it's a real celebration of men, as well as being a little bit reflective, but looking forward to lots of hope. So particularly at the moment, I'm short on on a piece of artwork. So if you know any men that have been creating that have been drawing, painting, colouring, you know, that have stepped up to the mark, that has found that as something to do to pass time through, you know, through this very strange period that we've been in, then please get in touch with me. I think I did just leave my details in the chat there. So one of the things with the Manbassador project, and a sort of a tangent to it from my other organisation, Space 2, is an art project where I can't take credit for producing the writing. There's a Peter Spafford who works for Chapel FM. He's been ringing some of the Manbassadors, which are local businesses who look out for men and work with us as our sort of middle person. And they're producing a few poems at the moment. So Peter's chatting with them, and he's pulling together a few words. And actually, I was blown away yesterday by the power of the words that he's put together based on his chats. So actually, as Hayley just introduced herself then, but the internet cut you out, Hayley. That's what Damien was referring to. Hayley's also done a lovely one, but I felt it was wrong for me to read Hayley's out in front of her. So I have another guy who is a barber in Easterly Road. There's a whole load of projects around barbers, hairdressers, and men's mental health, of course, because it's probably one of the only times that men sit in a chair for 20 minutes or 30 minutes with one person. So it's a good project. I'm doing it. So here we are. Here's Richard's poem. Never mind the ebbs and flows of fashion. I see lives change. Boy in the chair, now he's a grunting teenager. Then you're at his wedding. Holy crap, he's a dad, small boy sitting there. Happened so fast, like high-speed dubbing on a 90s ghetto blaster. I'm old school, always learning. The quiet conversation that happens in the chair. You can talk a guy through his divorce and never know his name. Guys are brutal, no whinging. Pain, run it under a cold tap, don't ask for help. But it takes its toll. Go home, have a drink. Lockdown's been hard. Maybe I'm just as dependent on my customers as they are on me. Suffer in silence? Sign me up, coach, for openness and honesty. And that's Richard's poem. So that will be going up as some street art on in LS9 at the end of March, and will be up for a couple of months. So yeah, and Hayley's is just as powerful. I really like the way they've been written. You know, they touch on men, they touch on opening up, and they touch on various other things. So yeah, thank you,
Lawrence. That was lovely. Where can we see these?
Well, you will be able to see them, I should imagine, on Space 2 and Feel Good Factor's website soon. You'll be able to see them in the flesh, so to speak, from, well, certainly the beginning of April if you take a walk along Hare Hills Road, and I'm sure I'll get information to you about where and how you can see them.
That's great. Well, thank you, Lawrence. That was really lovely. Thank you. I've heard it before and I knew it was a good one. So thank you. Great. Okay. Well, it's 5 to 3. We're not going to cover anything particularly meaningful now. I've put my thanks in the text box here, but thank you to all the facilitators and my brilliant colleagues as well for all your help with this as well. And I really appreciate everyone joining in with the workshops as well, from the feedback we've got there, you know, and everyone contributing to try and support men's health and wellbeing across the city. That's lovely. And if you've got any ideas about the format of the next meeting and the content, format and content, then please do email me with your ideas. Any way we can get as much crammed into this meeting as we possibly can. It'll be much appreciated. Any last things to say before we all chip off and get a cup of tea? It was snowing 2 months ago today. Would you believe it? Anyway, there we are. I think it was 2 months today. Anyone? No, we all want to go, don't we? Lovely to see you. Right, thanks everyone. Take care of yourselves. Thank you. Bye-bye.
Thanks, Damien.
Thank you.
Thank you.
Bye. Bye.
Thank you.
Bye.